In my lifetime, plastic surgery changed from something that was mainly for the rich to everyday folks. Plastic surgery has changed very significantly. I'm happy to say that I think we've accomplished the significant changes that have happened in plastic surgery. Another change that's happened in plastic surgery is the use of non-invasive. That means no surgery. An IPL machine that can take away blemishes, and it also can lighten and brighten the skin.
I've been coming here for approximately about 25 years now, so it's been a really long time. One of the reasons I do love coming here is that I feel that Dr. Capuano's approach is not only professional, but he's very conservative. He's got a really nice way of kind of looking at the whole picture of who you are, what you're looking for. I've started with, in my early 20s, with microdermabrasions. I do the IPLs, follow those with the newest procedure that's been in the office for the last couple of years, which is Axillus.
And this treatment is perfect for somebody who doesn't need surgery. It's going to prevent her from having to get it down the line.
New in plastic surgery is breast reconstruction using fat transfer. This is a magnificent new methodology. The breasts are very natural feeling and they look natural.
I was diagnosed with breast cancer at age 43. I chose to have a double mastectomy, and I had to consider reconstruction options at that point. Most of my chest material was removed during surgery, and I was left with essentially skin, very little skin to work with. I didn't realize that you lose all of the feeling in your chest. And I think that was probably harder to deal with than being diagnosed with cancer. Dr. Capuano told me about a procedure where he could actually transfer tissue from parts of my body. He would transfer that material in microdroplet forms.
The great part of this is the fact that the softness of the breast, and this was stuck to your chest, right? Mm-hmm. That was, it was painful and so on.
Going into the second transfer, I had developed a post-mastectomy pain syndrome along my rib cage and costochondritis in my sternum. I explained that to Dr. Capuano, and he said that the fat that he puts in there can actually coat the nerves, and let's try that in the next procedure. And when I woke up from the next procedure, it was snap your fingers. The pain was gone. I have the sensation that I did before I even started this. And that's probably been the single, that was probably what brought me back to feeling like a whole woman again.
Dr. Capuano and I feel like we kind of meshed very well together. He puts up with all my talking, and he's a really, really good listener. And I think what he does exceptionally well is understand what's important to each individual patient.
Hey, bring me some material to work with like I got over here.
I'd met with other cosmetic surgeons, and Dr. Capuano has a bedside manner like nobody else's. He's very matter-of-fact. He's extremely honest. He will not set unrealistic expectations. He's very talented. And I don't think, given the complexity of that surgery, that I would have had the same results going anywhere else.
I can see his wheels turning when he's looking at my skin, when he's looking at my face, when he's hearing the things that are important to me.
You might be terribly pleased.
Will I swell up really bad?
No.
I can sense that his mind is working to come up with a solution that will work for me.
That you are an excellent example of an individual who has done small things to avoid major surgeries.
We used to do mainly reconstructive procedures and injuries, and now we do mainly cosmetic procedures. I want something that is relatively simple, but very effective and without complications. That is my goal. But of course, the ultimate goal is to make someone feel better about themselves.